And
this meeting is being recorded.
I have had a request to make sure that we are recording this. I don't have access to Facebook, unfortunately, so I will make sure that this is uploaded, for people to view after. So once again, I'll be your MC for today. Before we start, I did want to share about our International Workers' Day of Action happening tomorrow at 9 a.m. Workers' organizations from throughout San Diego County will be mobilizing in a demonstration of class solidarity and internationalist unity with workers throughout the world to demand an end to all expressions of war, exploitation, and the growing gap between the financial capitalist billionaire class and the working class. The $770 billion war budget passed by Congress surpasses all social priorities such as healthcare, medical and Medicaid, housing, education, and protecting the environment. Instead, we have seen an escalation in funding for war on working people the world over, increased military aid abroad, including the ongoing occupation of Palestine, illegal and unilateral economic, financial, and commercial blockades against Cuba and Venezuela, and the continued funding of war at home with increased budgets for police, border patrol, immigration enforcement, and detention of migrant workers has aggravated the economic recovery of Black and Brown communities. The city of San Diego passed a street vendor ordinance that excludes and penalizes street vendors from vending at certain locations with threats of heavy penalties, and many are struggling to survive, and yet increased rents, evictions, and lifting of rent moratoriums, as well as the skyrocketing cost of rent, has driven many to homelessness. So housing must be a human right for all as well. All of this ties towards an expression of unity we San Diego workers will rally behind in our following demands for our day of action tomorrow: dignity for all workers, end for war funding, housing as a human right, end to the domestic war on Black and Brown communities, critical education and democratic schooling, and healthcare for all. Our rally will begin tomorrow at 9 a.m. in Chicano Park at the Kiosco in Barrio Logan, followed by a march. You can find the event on our social media at PSL San Diego, on Instagram and Twitter, and as Party for Socialism and Liberation San Diego on Facebook. Please share with friends and family and attend this important show of solidarity for workers around the world. So now I'd like to introduce our speakers for today. Our first speaker will be Forrest Smith, who is an organizer with the Party for Socialism and Liberation here in San Diego. He currently works as a maintenance care worker at an elder care facility and has firsthand experiences with the oppressive contradictions of our for-profit healthcare system here in the United States. He'll be speaking on the experience of our healthcare under capitalism, why ultimately insurance companies need to be abolished, and healthcare a guaranteed human right for all. Our second speaker, Tori Barron, is a Chicana socialist feminist organizer with the Answer Coalition and the PSL, and works at Planned Parenthood as a patient access specialist. Our comrade Tori will be speaking on the attack on abortion rights around the United States, including Roe v. Wade and the recently introduced Women's Health Protection Act of 2021. Our last and final speaker will be Zach Farber, an organizer with the Answer Coalition and a journalist with Liberation News. Zach attended a cultural delegation to Cuba in 2019 and is as part of the Answer Coalition, and will be reporting on the strides Cuba has made in guaranteeing healthcare access for all in their population, including during COVID-19 as one of the first nations with a near 95% inoculation rate among its civilians. He'll also be presenting on a socialist plan to guarantee healthcare for all. Afterwards, we'll have the opportunity for a brief question and answer discussion with our panel speakers. So without further ado, let's get started, and I will spotlight our first speaker, who will be Forrest.
Hey, y'all. My name is Forrest Smith. My pronouns are he and they. Thank you for joining with us in community to discuss our healthcare system under capitalism. My mother, Christine, was an emergency room nurse for more than 25 years. My grandmother, Lois, was a stay-at-home mother in a union steel worker family. And my other grandmother, Marjorie, had polio and raised her 6 kids from a wheelchair. Even within my own family, access to healthcare has varied dramatically. I reference this lineage because there are solid case studies to take away from many of our experiences within this capitalist healthcare system. Our access to and level of care within this system varies dramatically according to our relation to labor. For example, if you have a union job, are working for cash under the table, or are earning minimum wage, your insurance benefits will differ dramatically. Sometimes they will not even exist at all. This is particularly the case for unhoused and migrant workers, or those being coerced into labor within the carceral or sex industries. Additionally, history has shown that systemic privileges concerning race, ethnicity, sexual orientation, or political inclination ends up allowing disproportionate access to healthcare benefits within the US. A prime example is that many European settlers living on stolen land often experience quality of service inequities. That is, plainly better services in comparison to Indigenous, Black, and Asian communities today. Not only is it often more difficult for those communities to access services, but it is often more expensive. When we look at quality of service as well as good health outcomes following interactions with the healthcare system and healthcare practitioners, we don't need to scratch our heads and wonder, why is this system set up this way? Any more than we need to walk outside and question why the sky is blue. Those in attendance here today, and any internationalist who studies the historical development of humanity as a collective, is clear to point out that our healthcare system is flawed at its very foundation, and that it's a for-profit healthcare system. In fact, the United States is the only country in the world to have a state-sanctioned, for-profit health insurance system for providing civilians with standardized care. For example, I work in maintenance at an elder care facility here in East County. So I do everything from plumbing to electrical, heavy moving to masonry. I'm paid minimum wage for doing essential labor. I was sent into COVID positive rooms throughout the pandemic to carry out maintenance that was crucial and unavoidable for resident survival. Eventually, I did end up contracting COVID while on the job, and luckily, I recovered without any long-term symptoms or complications. That said, at this job, I do not make enough money to save for retirement or to even meet the increased cost of living here in Southern California. As the cost of consumer goods and the cost of living increased nearly 8.5% this year, my essential labor was only compensated for a 1% increase during that same time. That means that I'm making less this year than last year while doing the same work. And my insurance plan is bare bones. I did not even have any options, not many, I didn't have any options between different plans when signing up through my employer. I have United Health Group as an insurance provider, which is one of the largest insurance companies for low-wage employers in the country. Excuse me. This year, 2022, United Health Group is anticipating $317 billion, that's with a B, in revenue. The best year on record for their profit margins right during the middle of a global pandemic. Would y'all be surprised if I told you that my insurance premiums, copays, and deductibles were increased this year during this record growth in profits? Well, you shouldn't be, because I certainly was not. Let me be clear. This system is designed this way, to be predatory and parasitic for the vast majority of people living in the US. Our insurance options are limited, and when we have no democratic say in how our benefit plans are developed. So this is a reality that many of us, if not all of us, have to experience as workers. This is something that doesn't get discussed very often. We may hear Democrats or Republicans pay lip service to lowering premiums or adjusting Medicaid and Medicare in a cheap bid at securing the vote of passive elderly folks that simply want to retire with adequate health care. And that's understandable. And most folks we speak to will acknowledge that our healthcare system and how we do insurance has some pretty unavoidable pitfalls that need to be addressed sooner rather than later. Some may say that we can further regulate these insurance companies like United Health Group. Perhaps folks like Bernie and AOC would like to see them pay more of their wealth in taxes, and then use those taxes to expand healthcare services and expand coverage to those that currently go without. But we should also point out that those profits were created by workers, and that increasing taxes on the rich is merely a band-aid solution that misses the crux of the issue with private insurance companies that make huge sums of money off of our hard work. Some of the more radical folks will even demand that we should nationalize the institution as a whole, like wholesale, and just rearrange how insurance companies do what they do. But there is much more logical solution proposed by revolutionaries and communists. In the face of this healthcare crisis, where millions go uninsured or inadequately insured, where millions of workers pay huge premiums and deductibles for subpar treatment, while a few capitalists rake in billions in profit, we can and we will come together in order to abolish the health insurance industry altogether. Many people will scoff at such a proposal. They will say it can never happen, that the suggestion is idealist in nature. They will claim insurance companies have too much lobbying power in Congress, or maybe say, if it can be done, right, it will only make the system more complicated. In response to that line of thinking, I encourage my comrades to stiffen their resolve and to remember that we create not only the wealth in the country, but all around this world. And we're also the innovators and the problem solvers for our entire society's many crises we face today. There's no task or barrier too massive for us to address through collective and thoughtful central planning of our resources and labor power. From pollution and climate change to social injustice and racial segregation, economic exploitation, and colonization of the land and its people, the solutions for these systemic crises require us to tear apart capitalist transnational corporations and build an alternative future for our people that centers equitable and universal standards for premium healthcare outcomes, not only for those who can afford it, but for every person living on Earth. And so this brings me to my final point here in this discussion, is communists must stand strong and demand in all of our platforms and spaces that we engage with, that in this society we're building, under socialism, in whatever form it may take, healthcare must be a human right, period. We must banish these social relationships which dehumanize and devalue other human beings. We must stop seeing certain groups of people as disposable. While this goes beyond humans, an excellent way to push our collective liberation forward is to guarantee healthcare as a human right in a way that does not exclude or marginalize any other group of people. We can look to incredible developments in countries like Cuba, Venezuela, Vietnam, the Democratic People's Republic of Korea, or China, where social welfare programs go beyond reacting to the healthcare needs of its civilians and actually provides guaranteed universal services for all, including a robust plan for preventative approaches to medicine, including gender reaffirming procedures. Regardless of income, age, ethnicity, sexual orientation, location, disability, pre-existing health issues, legal status, or mental faculties, every human should have access to life-saving technology and healthcare systems that have in fact been produced collectively by all of us, the working class, all over the world. So before anyone thinks that I'm seeing the world through rose-colored glasses, I want to also point out that those countries don't necessarily have a perfect healthcare system. People do face struggle, within socialist societies. What I'm saying is that it's vital for us to study those alternative healthcare systems and to learn from both their successes and their shortcomings in order to move forward with developing a more successful socialist healthcare program right here in our communities. To take a step further, we must also empower and encourage people in our personal circles and neighborhoods to secure education about positive healthcare outcomes. In the immediate term, that can mean doing volunteer work, speaking with family members and neighbors about vaccines, providing mutual aid, joining an organization, and agitating, for additional resources from the bourgeois state in our underdeveloped communities. However, we must not lose sight of our goals in the long term. We are not trying to reform the current system. In fact, we are embarking on a journey towards no less than the total and complete liberation for all. This must definitively include both the access to and the means to access universal guaranteed healthcare as a human right. So feel free to stick around after the panelists and ask questions during the Q&A portion of this panel. I'm happy to speak to my experiences as an essential worker in a healthcare setting during the COVID pandemic, or to my family's experience as a registered nurse under capitalism, or as my grandparents have been aging, I kind of help them through some of those things as well. So feel free to ask any questions. I'm an open book. And just remember, there's more to critique and analyze, with this system than we have time for in one conversation today. And so it's important that we engage in it as a community outside of this as well. So onwards until victory, and have a happy militant May Day celebration, y'all.
All right. Thank you very much, Forrest, for that empowering speech. Next, we'll be hearing from our comrade Tori, who will talk about abortion rights for all and the attacks on Roe v. Wade.
Hi. I want to acknowledge for everyone here that I'm speaking out on Kumye land here today, and I really want to honor the people who came before us, pushing some of the most basic freedoms that we have today here. Hello, my name is Tori. I go by she, her pronouns, and I'm coming to you today not only as a San Diego local community member, but also as a reproductive justice activist and a revolutionary on behalf of the Party for Socialism and Liberation. And as stated, a proud patient access specialist and worker at your local San Diego Planned Parenthood. As we talk about healthcare here in the States and comparatively abroad, I want to remind all of you here today that abortion is a widely shared experience in the US and around the world. It happens literally every day. And the people in power currently just get to choose which lives get absolutely taken over by the restrictions, decisions, and health access that should only occur between patients and doctors. Even though there's tons of stigma and shame that many people still experience around this issue, many abortion healthcare providers understand that it's our work to provide a safe, non-judgmental healthcare so that communities everywhere can survive the day-to-day. This work is incredibly personal to me, and every day I see the faces of our community alongside the shortcomings of our healthcare system, paired with the hostility, shame, and protester presence we face almost every other week as well-known abortion providers. Even in San Diego, California. These protesters largely are peaceful, but highly miseducated and misled, and are a constant reminder for healthcare workers of our choice to work in abortion care. Some have offered my coworkers other jobs to quit. Some have openly harassed and gotten into arguments with patients. And we deserve to walk into a healthcare clinic without harassment as a patient or as a worker. We deserve so much more than to just survive with what rights we currently have as healthcare providers and people, which is why we at the PSL believe through only participating in organizing marches and rallies in our communities with our values will put organized pressure and power, and perhaps even be able to secure our rights and freedom in healthcare as we march toward a world led by the average working people like you and me. Towards a socialist future we desperately, desperately need. If you don't already know, the state of our reproductive rights in the US does depend on where you are, unfortunately. This has been a part of an ongoing and consistent set of attacks that have ramped up this latest Supreme Court decision to take on a court case that directly challenges the nearly 50 years of precedent from Roe v. Wade. This may surprise you, but the last 5 years account for more than 1/4 of all abortion restrictions enacted since Roe. 9 states, including our neighboring Arizona, had put abortion bans in place outlawing it before the court had ruled constitutional rights in 1973, a Roe v. Wade decision. 8 additional states have had trigger bans to criminalize the procedure if Roe is overturned, and most of them were enacted as recent as 2019. Through early October 2021, states have enacted over 100 abortion restrictions that year alone. Obviously, healthcare providers have had to deal with these obstacles to providing care all along the way with patients. Leading up to 2021, restrictions have been passed for decades, with each one making it harder to access and provide abortion services, and also building momentum for even more burdensome and restrictions and bans. 6 in 10 US women of reproductive age live in states that are hostile to abortion rights. 26 states are certain or likely to ban abortion to the fullest possible extent if Roe is weakened or overturned. Starting last year, the US Supreme Court is hearing oral arguments in Dobbs v. Jackson Women's Health Organization, a case about a blatantly unconstitutional Mississippi law, and that would ban abortion after 15 weeks of pregnancy. They are intentionally trying to rip to shreds Roe by ignoring fetal viability and realities that clinicians and patients face. This is how fragile the state of reproductive rights has been, and currently for individuals across the US and abortion providers who work with these patients every day. Sometimes with protesters or opposers right literally outside of our windows. It's strange because the state of Mississippi has already acknowledged the US Supreme Court brief that fetuses cannot survive outside the womb at 15 weeks. And that even with medical advances, even since Roe v. Wade, viability does not even become possible until after 22 weeks. Full-term pregnancies last 39 to 40 weeks. So why the blatant ignoring of medical science? It's because it was never about science for them, honestly. It's always been about control over our bodies and how and who we choose to live and love in our lives. This is about medical autonomy, bodily autonomy, and it's not an accident that this is controlling of marginalized bodies medically. And it's also a part of a long history of racism in this country that is absolutely tied to the pro-forced pregnancy movements in the here and now. Political abortion, anti-abortion rhetoric began with this message: abortion is for other people, not non-white people. Abortion became a political tool of racist white evangelicals as a response to the Black civil rights movement of the 1960s in particular. This must not be overlooked for abortion rights as healthcare providers or as people. And if we're serious about enough as society as combating racism and sexism as we were in 2020, then this history in particular, showing the dark underbelly of how abortion restrictions have always been tied to race and politics, should always make you listen up. As I alluded to earlier, abortion restrictions are political tools designed to make abortion-related care harder to access. They are not focused on helping people or improving medical standards of care. I know, working with patients firsthand, how abortion restrictions have had serious physical and mental health consequences, in addition to negative financial and social impacts. And I see it in the experiences of everyday people, even in California, where our laws thankfully protect a person's right to choose pregnancy. Furthermore, they exacerbate logistical and financial obstacles for people who are already struggling to get by, or people who are have reduced access to timely, affordable, high quality healthcare, such as people with low incomes, Black, Indigenous, people of color, young people, LGBTQIA individuals, and many rural communities, which is a lot of specific groups of people, if you haven't noticed. This is not accidental or coincidental, like I said. Restrictions of reproductive care is a part of a long legacy of this country of efforts to control people's bodies, families, freedoms. And especially when they don't align with the identities of those that have been prioritized by systems of white supremacy, patriarchy, and capitalism. At Planned Parenthood, we have this core service behavior: acknowledge the reality. And let's acknowledge this reality. We should speak up right now as a community. We need to push back now on these attacks, and not only for us, but for those who are most at risk. Although overturning Roe would unquestionably do harm, abortion providers know that Roe alone has never been enough for equitable coverage already. As long as people who need and provide abortion care are controlled, stigmatized, targeted, and harassed, true access remains an aspiration and not a reality in the US. And I'll repeat that. As long as people who need and provide abortion care are controlled, stigmatized, targeted, and harassed, true health access remains an aspiration, not a reality in the US. The Democrats in Congress in power have failed in so many ways. But to top it off, they also have not been able to pass the Women's Health Protection Act. And any abortion protection, like any abortion protection in literally 49 years since Roe v. Wade. This is the fate of our legal reproductions hang in the balance with this decision on the conservative majority Supreme Court. We need to and we must demand more from these elected officials. But that is not the only thing we should be doing. We should be pushing back in our communities, in our homes, in our workplaces, and beyond. That is why this community forum is happening, and to mobilize us for our consciousness, for all our reproductive freedoms and generations beyond us. We must believe that real results is possible if we work together and leverage our collective working strength as patients and as healthcare providers. Continuing to demand this legislation will move the right to abortion from a constitutional right to dependent on the political interpretation of the Supreme Court to a statutory right that protects healthcare providers and patients' the right to provide and to receive an abortion. And because if the justices uphold this law in Mississippi, those of us that have been at the heart of this work and advocacy know that the conservative state legislators all over the country will move to adopt their own 15-week bans on abortion and possibly restricting millions more that currently have limited access to already hard to afford and hard to find legal and safe abortion. Little by little, they have chipped away human rights of Americans right in front of our faces, usually in the name of self-righteousness or religion on its face. But this problem is much, much deeper than that. Let me be clear, these people who are pushing lawmakers to challenge any legal abortion are not pro-life. These people are pro-forced birth, pro-forced pregnancy, and pro-control. We must not waver in our resolve when facing a question of our own autonomy, and we must press forward and demand our society, our collective freedom from this state tyranny. Our oppression will not stop, and our opposition won't stop at anything to legislate any part of our rights away. And they think they're going to get away with it. We need to out-organize them, make our voices heard now to let them know who is really in charge. And this is why on the shoulders of so many reproductive justice people and revolutionary people, now is the time to push for full legalization, nothing less. We in our community should demand legal abortion now for all of us, no exceptions, continue to fight for the Women's Health Protection Act and for future bodily autonomy and freedoms of working people everywhere and us right here, right now. I especially urge you to get in touch with the Party for Socialism and Liberation and do what you can to leverage your power in your community by donating time or money to those on the front lines pushing for abortion legalization and access. We must also acknowledge that this problem is much bigger than just abortion healthcare access. This is the tip of what we deserve as working people. And we must demand to people in power that we want legal and safe abortion and nothing less for our healthcare. In the 60s and 70s, the women's liberation movement bravely spoke out and organized against the abortion restrictions in place and pressured states to repeal bans and legalize abortion. They built momentum and access to abortion leading up to the landmark Roe decision. But it takes that collective pressure to push back and heightened consciousness around this issue. And we cannot let generations of abortion rights roll back in the US without a fight. And I know the people that are gonna fight with me are listening to me right now. And this is the time. It's come for another movement to fight for the right for safe and legal abortion, as well as Medicare for all, and ultimately to socialism. And I say this because I believe only socialism can ensure that reproductive rights are guaranteed, including access to birth control, paid family leave, free childcare, free and accessible healthcare, education, housing. These demands in particular will deliver our full reproductive freedom. All of this can be prioritized. We just have to demand it together as working people. So stay in touch as we all keep each other safe. And so many wise people have said before me, together and only together we will achieve real freedom for everybody. I leave you with a quote. I say this as an affirmation every day from a beloved Black revolutionary, Assata Shakur. It is our duty to fight for our freedom. It is our duty to win. We must love each other and support each other. We have nothing to lose but our chains. Legalize abortion now, Medicare for all.
All right, thank you so much, Tori. And yes, abortion is a political and class issue as much as it is a gendered issue. And feel free to stick around for the Q&A, to ask more questions about how you can get involved in our current ongoing fight, to protect, women and all working people's abortion rights. Our last and final speaker will be Zach Farber, and he will be speaking on a socialist solution to our healthcare failures here in a capitalist society, and also from an eyewitness account from his travels to Cuba. So I'll let you have the floor and spotlight Farber. Take it away.
Thank you so much. I'm really looking forward to speaking to you all from Chicago, which is the home of May Day. So before I get started, I did just kind of want to touch a little bit on the importance of May Day and something that's happening right now, which is a huge youth delegation from the US that's in Cuba fighting back against the blockade, which has greatly impacted the Cuban people and their efforts to fight the blockade. And despite this, they've made remarkable achievements in combating COVID-19, which I'll get into here in a moment. So for us here in the US, we're very much used to a preventative healthcare, we're not used to a preventative healthcare system. So our healthcare system is very much reacting to whatever's going on, specifically whatever's happening at the moment in the greater society. So whether that be, like the swine flu, or like we just recently saw with COVID-19. We were not prepared to deal with COVID-19, and despite the blockade, Cuba was. And because of this, Cuba's developed its own vaccines to this date, I believe, that are effective. They begun sharing vaccines with other countries. They achieved a vaccination rate of over 90% from people aged 2 years and up. They safely reopened schools to all children on November 15th, 2021. And their deaths per 100K are as low as 73.31. So, let's compare this success story to the US, which is the richest and arguably the most powerful nation. Vaccine rates nationally are hovering around 61.9% here in the US. And a lot of these numbers that I'm using were last taken January 1st, largely because the US has stopped counting a lot of this stuff. The US also has a violent right-wing anti-vax movement that's agitated against basic public health. COVID vaccines were developed with public funds, but used for private profit for biotech giants like Pfizer and Moderna. There's vaccine hoarding, which holds back the distribution to the global south. There are new surges, which lead to overcrowded hospitals and a crisis of medical worker burnout. There are, and this is really stark. So remember I said there were 73.31 deaths per 100,000 people in Cuba. In the US, that number is more than 3 times higher at 240.18 deaths per 100K. And I talked a little bit about why this is the case, just, talking about how this is a, this healthcare system is reactive, like rather than preventative. And this is something that I've experienced even in my own family. My mom survived her initial bout with COVID, but passed away from long COVID symptoms. And, I'm at least confident, having been to Cuba and seeing the system, that the situation she was in, which eventually led to her death, would not have taken place had she been in under a preventative system like Cuba has, maybe even a Medicare for all system, not even a social system quite like Cuba's, but just something that is geared towards preventative care rather than only reacting when things are at their absolute worst, especially during COVID when hospital beds are skim. It could be hard to even get a hospital bed if you don't test positive for COVID at the height of the pandemic there. Cuba began to create a rational COVID plan based on a scientific understanding of the virus rather than the interpretation of the economic impacts of it. And this happened right from the start. They promoted accurate information about how to protect oneself and one's community against the spread. And they went to work early in 2020 in developing their own vaccines in Cuba's world-renowned biotechnology institutes. And, tourism in Cuba is one of the main sources of income aside from Cuba's biggest export, which is doctors. So the COVID pandemic really took a hit on Cuba's tourism industry because the government shut down tourism to prevent infection and mass death. And this was largely successful, as illustrated by the numbers I referenced earlier. And so, when it became clear that schools needed to be closed for the safety of all, the government provided consistent educational services via lessons on television. Again, Cuba making the best of what they have despite the impacts of the blockade. And when the vaccines finally became available, despite many challenges, including, a syringe shortage as a result of the US blockade, people were able to access the vaccine without obstacles, and people willingly went to get vaccinated. Cuba doesn't have a vaccine mandate. And there was a major international solidarity campaign, which the Answer Coalition was proudly a part of, which was undertaken to donate millions of syringes to Cuba. This came from Canada, the United States, and European countries. And just a quick side note on that, we've been talking a lot about some radical solutions to healthcare, but we don't even have to look towards super radical solutions for a vast improvement on what we currently have. We can even look to social democratic and liberal countries in Europe even. So I think that's really important to point out too, to really illustrate how poor healthcare is in the US and why COVID is so rampant here. And as a result of Cuba's efforts, the schools are now open, tourism's resumed, And the number of new cases, hospitalizations, and deaths due to COVID have dropped dramatically. They were pretty high in the summer of 2021, but that was really only for a few months, kind of like we're seeing right now in China. And just even a quick note on China too, more people during China's surge over the past couple of months, fewer people died then and throughout the entire pandemic than in the US just in the first 2 weeks of March 2022. So I think that's pretty significant. So, this remarkable achievement, or these remarkable achievements by Cuba really rest on their foundation of socialist development. And the revolutions prioritize education, from their literacy campaign to advanced education at every single level. The revolutions prioritize healthcare. And so Cuba has a universal and completely free healthcare system. And there's a kind of a saying in Cuba where they say, it's free for you, but at the cost of the government. Over half of Cuba's national spending is on healthcare, which I think is amazing, considering almost half of our spending is just on the military. Years ago, Cuba made a conscious choice to develop their biotechnology industry, and this really helped them be able to implement a plan leading to not one, but and I think previously I said 4. I think they've actually developed 5 vaccines. And so their mass literacy and high educational levels mean that in addition, the Cuban population understands scientific concepts. In Cuba, illiteracy is virtually eradicated, except for in cases where people are like too disabled to learn how to read, for example, or too young, obviously. In the US, the literacy rates are as high as 13% in recent years. So that really alone shows why a big portion of the population in the US is able to be fooled into such silly anti-scientific, anti-public health rhetoric and beliefs. In July, largely when a lot of cases started popping up, Cuba's vaccination campaign was launched, and it took about 2 months to show dramatic effects. On September 19th, there were more than 8,500 new infections and dozens of deaths per day. But as vaccinations took hold, the COVID positive numbers began to drop every day, starting in October. And so by mid-December, the daily new cases didn't reach above 80, despite the increase in cases in the last week of December. And there haven't been huge spikes since. There was a little bit of one in January, but since December, only 19 people died that month. And I think yesterday there was like 1 COVID death recorded in Cuba. So it appears that the high rate of vaccination is preventing severe illness in breakthrough cases. So Cuba is really illustrating itself that what we're seeing with when people get vaccinated is that the impacts of the virus are not as heavy, and that's likely true even in the US. It's largely why COVID has declined here as well, although there's no telling if or when there's going to be a virus that's able to break through consistently. So Cuba's had a consistent lower rate of mortality in COVID cases, thanks to early medical intervention in positive cases, as I alluded to earlier. And so Cuba's mortality rate is under 1%. And in the world, it's almost 2% and over 2% in the rest of the Americas. So Cuba is not only, one of the best in the hemisphere, but the world with regard to COVID mortality rate. And children are vaccinated from the age of 2. So well over 90% of Cubans have received their first doses of the vaccine. And this places the island second only to the United Arab Emirates in terms of vaccination rates. And there's no country in Latin America that has produced its own vaccine, a single one. I think that stands true to this day. And there's no other Latin American country that has such high vaccination coverage. It's not even close. And before I start to wrap up, I did want to talk a little bit about why there's no anti-vax movement in Cuba. So it's not just the existence of well-educated, well-trained scientists, doctors, and nurses. You know, it requires a collective effort and leadership to defeat the vaccine. Cubans accepted the restrictions needed to stop spreading the virus, not only because they have an accurate understanding of virology, but they also feel the social responsibility to prevent death and social destruction at any cost. And for Cubans, social distancing, maxing, getting vaccinated were not a question. Cubans aren't fed a steady diet of individualism. Values of solidarity are instilled in the Cuban people from a young age. And most Cubans understand that means making sacrifices to help others. And not only that, but Cubans trust their government, not just because the government works to provide healthcare, education, housing, and food, but it's always upfront and honest with its people. And this is something that's unique even among some socialist countries. So people understand that their government isn't some entity that's like above or separate from the people. The Cuban government is the people. And in the United States, you know, most people do have a reason to lack the health insurance industry and the medical system. But this understandable mistrust has been weaponized and combined with racist ideologies and extreme individualism, fueling a movement against vaccination, masking, and other public health measures in the name, in the name often of in quote unquote individual autonomy. And you know, the false freedom or options for freedom that were presented in capitalism mean that right-wing politicians and you know capitalists are allowed to essentially lie to the people and propagate dangerous falsehoods about COVID and the vaccine, threatening scientists and experts. And Trump as president rallied day after day to, you know, and spoke out against experts' advice, helping to create a great mistrust of the vaccine. And this caused needless deaths of hundreds of thousands of people. You know, the Florida and Texas governors were among the first to ban mask mandates in their schools, even in elementary schools, and this was catastrophic. That clown who just bought Twitter, Elon Musk, called California Governor Gavin Newsom a fascist for imposing limits on public sites and work sites. And you know, because of this stance, a recall effort was quickly mounted. But it was ultimately unsuccessful. So the mistrust and individualism of millions of people in the US, grown on top of a lack of scientific literacy, has really led to this anti-public health movement we're seeing in the US. And the education system, which is underfunded, and the fact that public school curricula are determined state by state and can be influenced by the local and state political processes, has had a really negative impact too. And, you know, this is also, the COVID has been weaponized in a lot of the same ways that like the alleged teaching of critical race theory in schools has. And the politicization of education has also, the right-wing politicization specifically, has negatively impacted science and health curricula. And it's led to a failure in some locales to even teach basic evolutionary theory, which is essential for understanding how viruses mutate. So the US is the only developed country that doesn't have a universal healthcare system. And instead it ties medical insurance to employment. So Around 40 million Americans have no coverage at all whatsoever, and 8 out of 10 of these are working class people or their dependents. The health coverage of others is so poor that people don't seek medical attention they need because they can't afford the thousands of dollars in yearly deductibles. And many immigrants, especially undocumented people, don't use the health system for fear of deportation. So they're denied, and they're also denied eligibility for the Affordable Care Act. So since our system's controlled by insurance companies, health maintenance organizations, pharmaceutical manufacturers, medical device producers, hospital systems, and other private corporations, healthcare is a commodity sold to those who can afford it. Healthcare has become a scattered array of unconnected services. Each service provider seeks to charge the highest price that they can, and expensive cures and costly designer medications are prioritized rather than basic healthcare. And this is obviously just because it brings in more money. In Cuba, I saw something very different. I toured something called a polyclinic, which is, it's just a multi-story healthcare center, and there are different floors dedicated to different types of care. And it allows for a more interconnected community approach to care, to all kinds of care. And it's at 1/10 of the cost of the US. Today the US spends more on healthcare than any developed nation, but this hasn't brought good health. There's been across the board decline in well-being, health, and life expectancy. The life expectancy tanked in the US. Cuba has a higher life expectancy than the US, and there's a widening in the wellness disparities between rich and poor in this country. So, as Forrest and Tori illustrated clearly, it's no secret that the US healthcare system is badly broken, but we also need to talk about how it can be fixed. There's an excellent model in Cuba. Why look to Cuba simply as a lesser developed country, given the advanced state of US medical knowledge? So, we can look to Cuba because Cuba has a lower infant mortality rate than the US. It has a higher life expectancy, especially now, since the decline in life expectancy in the US from COVID. It has more doctors per person. There are 9 doctors per 1,000 inhabitants, which is by far the highest in the world. And the US has 2.9 doctors for every 1,000 people. So Cuba has 3 times more doctors per 1,000 people than the US does. And I think that's, that in itself says a lot. And like I said, it accomplishes this in far less money. So in Cuba, spending less brings much more, because despite extremely limited resources due to economic sanctions imposed by the US for almost 60 years, Cuba's managed to guarantee access for everyone. And they don't exclude immigrant populations. There's no apartheid system in the US for folks who don't have citizenship documentation, quite like there is in the United States. So we should look to Cuba. Cuba's healthcare system shows that efficient care can be provided at a much lower cost, and all that requires is a focus on primary care and prevention. We should look to Cuba because being able to do more with less, we can have the best of both worlds. The current US advances in cures combined with Cuban integrated healthcare model would really, really bolster healthcare on an international scope. So we need to end the blockade on Cuba, like our comrades are fighting to do in Cuba right now, and they'll be participating in the May Day parade. I hope everyone here will be at Chicano Park tomorrow at 9 a.m. And we should look to Cuba because even under a very difficult situation, socialism means a better future for our people. Thank you.
All right, thank you so much, comrade. So that leaves us with our Q&A. I have a few questions I started with from the group for each of our three speakers. But if you have any questions, feel free to raise your hand or drop them in the chat. Thank you so much.